session. Thank you for that. We also have captions available. If you are interested, you can find the captions down at the bottom. And then I see that they're also dropped in the chat as well. Thank you, Chloe. So we'll just take again another minute for folks to introduce themselves. You are welcome to introduce yourself in the chat. We will be recording this sessions and then uploading the recording to our website. So you can go to the next slide, I think maybe. So purpose of today's session is just an open forum. We're here to answer any questions that you may have that are related to the RFGA, the request application, budget and the work plan, our website that I referred to, the different program areas. So please feel free to ask any questions in the chat, or feel free to raise your hand, and that's what we're here to help you with today. And if there's anything that you specifically want to see, we can share that on our screens. So if there's a certain document or application, please let us know. And when we ask questions, we can kind of refer, share screen, pull up different things. But again, we're just excited to have you all here. Thank you for joining us. I think we can go ahead and open up for some questions. Does anyone else want to jump in and introduce themselves next? Or we can also just jump into questions. Oh, go ahead, Dolly.
Dolly England here, she, her, queen. I am the Community Engagement Program Manager. I hope that there are people in this group right now that sent us emails and who I politely said, please come to our information session and ask more questions. Because to be equitable and fair, we've created this space for you to ask the questions. I see Carrie's hand raised, but I'll hand it to Jessica first to introduce herself.
Hi there, thanks Dolly. I just want to introduce myself really quick. Jessica Beltran, she, her, ella, and I'm also a community engagement coordinator and been leading this RFGA welcome. There's also a lot of program staff here, and I invite you to program staff to introduce yourselves in the chat. And Carrie, thank you for being the brave one to raise your hand first. What's your question?
Thank you. Can you hear me all right?
Yes.
Okay, thanks. I have two questions. On the first page of the application, it asks for a UEI number. What is that?
Hi, UEI number is, I forgot the abbreviation really quick, but you registered to SAM.gov, and I'll verify this in a minute, and you obtain that number there. It's a unique entity ID. Yay, I got it. Okay, so you have to register to get this UEI number, and we have some simple steps on how to do it that we can share with you, Carrie. I'll plug in some instructions here in the chat. You can also follow up in an email if you need more help with this. This question is being added to our FAQ, which I will update by the end of today, since we've had a couple of folks ask. You need that number before you are awarded funds. If you don't have it right now, you can still apply. We didn't list it as a requirement, but you will need it in order to be funded. So I'll share that there. I'll plug some stuff on the UEI here in the chat. Was there any follow-up to that question, Carrie?
Yes, thank you. My second question is about the professional liability insurance that referred down to the attachment, and there is a lot of different types of insurance listed there with specifics, but I didn't see anything listed as professional liability insurance. Is this like board of directors kind of information insurance? I just needed some clarity on that.
Carrie, good catch. That was an error in our first version of the RFGA, which has been updated. So the RFGA should no longer say that. That is why there's no information regarding this insurance, because it's not a requirement for you. So new RFGA
Okay.
should not have that. Don't worry about that. Yeah, that was from a previous RFGA. And
Okay, thank you.
no problem. I'm not sure whether John or Chelsea's hand was first.
I think it's Chelsea.
Yeah, hi. Can you hear me all right? I had a couple questions about the budget template. I noticed on there that it said if you are only applying for one section to use the other template, but then I wasn't sure where the other template is located. I can't seem to find it. I'm not sure if I'm just overlooking it.
This is Dolly, and Zach, I think that it is the template that's on the website, but I think that the point that we actually need to point out, and again, correct me if I'm wrong, is that if you're applying for more than one program area, then you have to fill out a budget for each program area.
That makes a little more sense to me. So it's all the same template. It's just the amount of them that you fill out.
Correct.
And then my other question on the budget template was that if you have more items than there is space for, so for instance, under other, they give us 3 lines for items under other, but if we have more than that, how do we go about kind of adding those in?
I already saw Zach unmute. Zach is our fiscal dude and knows the fiscal things.
Yeah, hi, I'm Zach. I'm the fiscal dude, and I know some of the fiscal things. For that area in specific, you should be able to unhide rows. If you click on the left-hand side and highlight like the 2 rows, if you're in the Excel doc, I think it's 57 and 66. And you just highlight those 2 rows, right click, and it should allow you to unhide it. And I think we tried to do that on the other section, contracts, as well as personnel and fringe. So if you do happen to have more rows, you should be able to unhide, and I think you can actually add rows too. But if you have problems with that, please, well, I don't know, reach out again and we can send a longer version for you to fill in more information.
Thank you so much. I see that now, so I appreciate it.
All right, the questions are coming in fast. Let's do John next.
Thank you. I actually had the same template with multiple projects question as Chelsea, so thank you for resolving that. One other budget question though, for the indirect cost rate, do you have any requirements or guidance on that, or is that of each organization's choosing?
Zach or Sasha, I see you on mute.
Hey there, this is Sasha Ruddy. Also fiscally is what I'll say. And it's up to your discretion. A good range, we were very flexible. A good range is somewhere between 10 and 20%. But if you need guidance on how to create your own indirect rate, we have resources available for your organization, but we don't dictate that. We're very flexible.
Wonderful, thank you.
Thank you.
Well, hello, Erlette.
Well, hello. Hey, you'll be so proud of me. I'm almost ready to submit everything. But I do have a few questions. So that UEI number, that field is a required field. So if I just type in pending, I'm hoping that it'll go through, correct? As long as it has something in it, right? Okay, yeah, because I'm still waiting on it. So I don't know how long it's going to take the feds to get it assigned. Second, I read somewhere and I can't find it anywhere, but when we go to submit attachment 5, which is a verification letter, are you looking for the determination letter, or are you looking for the articles of incorporation?
The determination letter, Erlette, that has your number on there, because we're going to use that to plug it in and verify the 501c3.
Okay. And then another question is, I had a meeting today with another CBO who is in our same county, who is applying for emergency preparedness too. And we discussed about how we might be able to partner. And we had a question though. The funds, how could we partner using the funds? I mean, is it that I could purchase something and they could purchase something and it could go to the same cause, or if they are needing funds for something, I could give it to them, or how is that going to work?
I think the question is, how are you going to make it work, Erlette?
I can make it work anyway.
Well, my first question would be, okay, you're working together. So my assumption is that you are both submitting an application in your own request for funds. And somewhere in your work plan, it'll say that you're working together. So in this example that you've given, Erlette, I'm not going to tell you how to spend your money. That's exactly what you need to tell us. And so let's say you're going to do an event. Let's say you're going to give away whatever. You're going to have food and entertainment, and you're going to educate people about preparedness on the coast. You all, between yourselves, my assumption is, would decide how you need to spend your funds to create the event together for your community. So maybe you're paying for the hot dogs and maybe they're going to pay for like the DJ, and I don't know. That's something you two would work out amongst yourselves. But if what you've described is that you are both separately applying, then we will separately give you money. But I will expect to see in the work plan that you're planning to partner together. And I saw Sasha on mute, so I hopefully didn't say anything incorrectly.
You didn't say anything incorrectly, but Zach unmuted first, so I'll let him go and see what there is.
Yeah, I just wanted to add on to what Dolly said as kind of a word of caution, to just make it very clear in the distinct and different costs, especially when it comes to your work plan and your budget. We wouldn't just want to see one line for the same item or for the same event on both your work plans, because then it would make us go, wait, I thought this CBO was doing this. Wait, this CBO is doing this. Is this a duplicated cost? So just to be really clear about which of you is paying for which components if you do end up partnering in that way. And I'll pass it to Sasha if she has more to add.
Does that make sense, Erlette? Like if your organization for this event is going to pay for the hot dogs and the other organization is going to pay for the DJ, you just spell that out in the budget for line items. Does that make sense?
Yeah, we don't have that broken down into that much of a detail yet. So, I told them that I would ask. I don't know if they're on this call or not. I invited them to this one, but I did mention them in the work plan, but not as an itemized line item on the budget. So would that still work?
I think that if you are planning to do an event or activity in partnership, we would be more interested in seeing the resources you might need for those things. And if you don't know them yet, then where we will pay attention is if you're awarded, we would be then looking for the hot dogs and that breakdown on an expense report. So
Okay.
Sasha, do you want to add to that?
Nope, that's it. Dolly, you got it. So it's more, we want them to talk to each other. And by that, I mean, we want the budget to talk to the work plan and vice versa. So if you've included it in some way in both the budget and the work plan, even if it's not quite as detailed, that's okay at this point, Arlette.
Okay, and then if they or one of us doesn't get approved for the grant, then it could be adjusted. Whoever gets approved can adjust that budget accordingly, right?
Of course, budgets are flexible tools.
Okay. That's all I have right now. Thank you.
Thank you, Arlette.
Okay, I think we're on to Kelly, and Kelly, you have questions in the chat too, so hopefully we can get all of yours.
Yes, that is my question actually, since we were kind of already on the topic of like coordinating with partner organizations. I work at the lead houseless services provider in the Mid-Columbia River Gorge, and we, from some of our bigger COVID grants we got from the feds over the last few years, have some standing partnership relationships, especially with culturally specific and responsive service providers. And we basically have administered these big federal grants and then had subrecipient contracts with them. So I looked at section B, I think it's like 13 and 14, and it talks about subcontracts and third-party beneficiaries. And I'm curious if you can like give me some layman's term like explanation of what that means for organizations that either have existing subrecipient relationships with partner orgs that might want to apply for this funding, or might want to apply with those organizations, but in more of like a fee-for-service model. How does that relate to the rules that are in the proposal or request for proposals about subcontracts and no third-party beneficiaries?
Okay, so I'm going to start with the hardest part of your question. This grant is not appropriate for direct service. If the work that your organization is doing is really focused on giving direct services to an individual, and you're hoping to use this grant fund to do any kind of wraparound support services, groceries, things like that, this is not the resource for that. If what you're interested in doing is doing outreach and education, or doing policy work, or doing assessment work around the topics, then you could partner, and it could look like what Arlette just described. You're working with others in your community that are doing similar work or have similar population. It could also look like we're gonna subcontract with this organization who's gonna provide translation services for the work that we wanna do, or this person's gonna do all our social media, or so it could set up in that way. I think that I think some of what you're talking about is federal funds, and much of the funds that we're working on aren't, they're going to be state funds, but that's part of why we ask you to do the UEI, because we don't know, we might get some federal dollars too. So we try to keep it loose for you, and so that we have a pathway should that money come. I said that in a very Dolly way, and as you get to know me better, I say things in a Dolly way. Zach is going to say it in a smarter way.
Okay, can I ask a follow-up question? Zach, you can go ahead if you want to, but.
Go for it.
So what I heard is that you said this can't provide support for direct services, but my read of the request for proposals is that organizations that are working with communities with disabilities and in rural areas, including racial justice oriented organizations and houseless services organizations that are doing prevention activities and activities related to social determinants of health, which housing is like at the very top of that list.
I don't
If we're doing
disagree.
outreach and education to say, hey, we have shelter beds available and we have money that we want to help pay to our partner organizations to pay their outreach staff to get people who are living outside in those beds if they're outside during severe weather events or climate events, that doesn't count because it's not like planning
That's
and
no,
system
Kelly.
building.
That is the exact connection that I need you to make. So
Okay.
you broke it down and connected the dots beautifully, Kelly.
Okay, so that is
Because
okay.
what I don't want this money to, what this money cannot be used for is to pay for the housing or to pay for the bed or to pay for the shelter. But what
Right.
you just described is a beautiful example of a project and thinking outside of the box. I love that idea.
And so then to just make sure I'm clear, the fee for service model. So if we said, we're the central organization applying for this funding and dealing with the administrative burdens, but then we're going to set up more simple subcontracts with partner organizations and say, for every client that you do outreach and education with and then place in a shelter bed and help build a housing stabilization plan for, you're going to get X rate. Like, is that an acceptable third-party relationship?
I would say yes. How you run your contracts and your pay schedule for the contracts is up to you. What I wanted to say about your initial question about the subcontract section and it being in layman terms is basically we want transparency on what's going on with your subcontracts. We want to know who you're subcontracting with, what they're doing, and if we have further questions, we're going to ask for more details because that's the key, is really knowing for us to know where the money is going.
Right. Okay, yeah, I think we would lay that out clearly. I just wanted to make sure that our basic model that exists already in the Gorge would like be fundable under this.
And I believe it would, so long as it as it works. How do I say this? If you can make it work with the way that our pay schedule is going to work for you. So if your organization has no cash flow issues in doing things that way, you know, our intent is to issue monthly payments, and you'll see a lot if you are get awarded in the contract about the way that we do payments and the way that we do reporting. So that's what you'll be responsible for. And if the subcontracts that you're running work within that framework, then we're good.
Okay. Cool. And then to clarify the pieces about how you can't have a subcontractor third-party relationship without like explicit permission from OHA, is us writing that into our application and then signing a grant agreement, basically that permission?
Yes, it is.
Okay.
So long as it's in the work plan and the budget, then that is that mechanism. You're exactly right.
Awesome. Thank you.
On this topic in the chat, I just want to read this out loud. So Monica asked the question, do we need to submit MOUs, which means memorandum of understanding with partners for this application? And no, you don't. Even when you contract with OHA, if you have subcontracts, we still don't need those MOUs. We don't want them even. So you keep them to yourself. We are grateful that you're doing that work, but we don't need to see them.
Thank you.
Okay, next person. Hello, Robert.
I believe that is me. I have a few questions. First of all, my understanding of this RFGA is that we are to work with the OPHAs, right? Is that correct or not?
We encourage you to connect with your local public health, and we would love to see you partner with local public health, but that may not be possible where you are, or it may not be what you're looking to do.
Okay, yeah, because there was a sentence there like this must be planned with your local HPA. So
what is that for the assessment piece?
Maybe that's
That's, I think, the
where,
connection. So there's one
Okay.
part where we ask that if you're
got
gonna
it.
do, you know, a community assessment on health in some way or another, that you would contact your local public health, because they are gonna have a lot of the information and resources that you would be looking for likely in your assessment. So I think
Okay.
that particular one, we do want you to have reached out and made an effort to be like, hey, we're interested in doing this. Can we partner with you?
Yeah, and that is one of the things that we were thinking of doing. Okay, so and then there was where it says applicant, this is on page boy, it's not giving me the pages. 20. It says it refers to 6 questions. If you do so, be sure to address each project and program area you're applying for under each of the 6 questions. And I was wondering what questions that was referring to, because when it says, please see the FAQs for examples, I couldn't find the FAQs either. So what 6 questions is that referring to? Are there, yeah, what 6 questions are they referring to?
Robert, where is it that you're looking at the RFGA?
Yeah, I'm looking at the RFGA. It's page 18, actually, at the bottom of page 18, in the second to the last box. The heading is applicant information part 2. You may propose multiple different projects in different program areas. If you do so, be sure to address each project and program area you're applying for under each of the 6 questions.
This is Zach. I have a theory on that, and the theory is that we should have said 9 instead of 6 because there's 9 questions following that. But Jessica, you can double check me if I'm right on that.
I feel like you might be right and that we made a mistake. Thanks for finding it, Robert.
Okay,
You're a smart guy.
and then,
So it's
yeah,
9
because
questions.
I pared it down to 12 pages. You know, and then the other question I had, just to make sure, because, you know, I've applied on places where there's portals, and then come to find out, because we can't save on this one, when we get to the bottom where it says, you know, authorized grant applicant name, is that the end of it? Or is, when we get to there, is there going to be like a new questions, a series of questions to appear that we're not aware of in the application portal? Are the boxes that we see there and the questions that we see there and the things to fill out, is that everything? Like when we complete that and it says submit, there's not going to be like, oh, by the way, we need these 6 financial documents, which I've had happen before with the Kaiser grant. And I'm like, that's nowhere, it's not anywhere. And then several people were not able to apply and they're like, we're sorry, we just don't allow any exceptions. I'm like, then your instruction needs to be better. Anyways, I found out we weren't the only organization that had that issue. So I'm just making sure there's not going to be any more questions so that we're prepared for it if that happens.
Thank you. I was trying to see if Neil is here. He designed our form. I'll confirm right now for you, Robert, but you should see all of the questions in the form there.
Okay.
As a tip, that form is an exact reflection of the RFGA. We just had to convert it into a form style to be fillable. So you can also follow the RFGA document and you'll see that that form matches the same way.
Yeah, I saw that. And then I had one.
And
more
I'm gonna
question.
jump in. This is Sasha again.
Yeah.
And Neil is out today, so he won't be able to confirm, but Robert, to your point of when you enter your name and hit submit, no, you will not see like attach 12 more documents.
Okay,
Yeah. What
Okay.
we're looking for is for you to attach budgets, depending on how many program elements you're applying for, a work plan, letters of support. Those are the things we're looking for you to attach things. And the last piece would be your verification of your 501c3.
Okay, yeah. And then the RFGA talks about 5 parts, one being the sample agreement. I don't see where we're going to attach the simple agreement. It seems like we don't have to do that. Am I correct in assuming that?
Can you explain more about a sample agreement? I'm unsure what you mean by that.
Yeah, it says that in part of the RFGA, it says that one of the things we have to submit is a sample agreement. And that is not the case on the portal.
Because I'm unsure of what you're referring to specifically. No, you don't have to attach a sample agreement.
Can you tell
Okay.
me where in the RFGA you see that?
Yeah, I'm going through there. Yeah, we can, I'll drop it in the chat so that people can ask questions.
Sasha is correct. There is no sample agreement necessary. And I was sharing my screen because I wanted to address the concern of not getting everything. We have tried really hard to be as transparent as possible, give you all the information as possible, so that you can submit and not have questions or concerns. And this session is an example of that. So hopefully we will do better in this grant process, and that we will continue to do better as we move forward. So check that out. And yeah,
It's on page 26.
page 26.
Hey, Dolly, what he's talking about, it says attachment 5, sample grant agreement template. It's like the contract that is sent out after it's awarded.
Yeah, yeah,
It's
yeah.
a post-award process then.
Yeah.
Okay,
Yeah.
got it.
So that's for your reference of what the sample grant agreement would look like if you are awarded funds. It's not something that you have to submit to us.
Okay, thank you.
Go ahead, Charlotte.
Hi there. Thank you, Robert, for all those awesome questions. And I think Jessica already answered the question. I'm just going to make sure I understand you, that on the smart sheet, each field for the 9 questions, each field can have a maximum of 4,000 characters. And I get you that you really like succinct. You know, let's not go to 4,000 if we don't have to. Okay, so that's correct.
That is correct, Charlotte. Thank you.
Then let's see, how many letters of support can we attach? Is there a limit to that?
No, but I don't want to give you hope that I'm gonna read it all. I'm just keeping it real, Charlotte, because
Yeah, that's great, because like, for instance, this kind of relates to my second question, Dolly. So a subcontract question, or maybe this also goes to the finance guru guy. So this actually, we are really lucky. This is Portland Harbor Community Coalition has been working on an agreement with Multnomah County, which is the local public health department, to do a big assessment of air in a specific place. And so the way that the plan is worked out, there will be multiple very small subcontracts with actually on the ground truthing people going out and using these mobile air quality monitorings in priority populations. This leads to my question about subcontracts. The way we would like to put it in the budget is that there's a sort of a set amount for to be distributed among, we don't exactly know the number of smaller orgs that will be able to go out and do this monitoring. So the way I would sort of frame that would be to subcontract for a multiple community-based organization, community-based organization. Does that make sense?
That does make sense to me. And it's one of those things like with the budget and the budget being flexible, it's kind of, you tell us as much as you can about what the intent is of that line item. And then as it gets sussed out more, as you go through it, you can let us know and adjust your budget to reflect who those subcontractors end up being.
Wonderful. And then really simple question here. You've said, we do need to attach verification of 501c3 status. And I was just noticing that this group that I work with, it's not the determination letter on a standard, PDF. It is a JPEG screenshot of that. Is that going to fly?
Yes, as long as we can see your number clearly on there, which is what we're going to be using again to verify your 501c3. And we can follow up with you if that's blurry or not sufficient, Charlotte.
Okay, awesome. And then the final I think this is going to be not relevant to the budget, but so what I can put on the budget is there's additional funding that's still not for sure from the county. So since it's not for sure, I just can't say anything about it. Is that right?
I maybe wouldn't.
Okay, sounds good. Thank you so much for this session. It really helps.
Yes.
Hello.
Hi. Hi, Ari. Yes. And I wanted to say out loud that I know we're getting close to 3 o'clock. We will stay on until 3:30 to make sure everyone's questions get answered and to make sure we can go through the chat. Go ahead, Ari.
So I have a question about the vaccinations. We talked to the officials in our county public health division, and we were talking about vaccination events for recently arrived refugees from Eastern Europe. So the county is ready to provide vaccines and cover the cost of the vaccines, but there's still costs related to organizing these events, advertising these events, and covering the and compensating the staff. So can the funds be used for that?
Yes, and I would love to invite Mary Beth because this vaccine conversation really relates to acute and communicable disease prevention, and that's her program. I'm going to say yes, you can support vaccination events, the food, you want to pay for, of course I want you to pay for your staff time. I don't know what else fun thing you might need at your event. We've gotten good at vaccine events around here, Sasha can attest. Do you have any other thoughts, Mary Beth?
Hey, can you hear me okay?
Yeah.
We can.
I just got a new computer today, so I'm still trying to learn the ropes a little bit. Yes, I agree 110% with Dolly. So vaccine event sounds fantastic, and whatever is associated with those costs sounds great.
Okay, thank you. So the next question is about emergency preparedness. Usually it's a good idea to have some basic supplies, right? Like emergency kit, emergency medical kit. And there are some people, again, talking about the recently refugees who don't have means of purchasing this or won't even know where to go to get it. So I understand that spending the funds for equipment is not an option, but is that an option to purchase supplies, some basic supplies like that, and distribute them to different days?
I see our friend Ines has come off camera.
Hiya. So I want to confirm I heard your question. I didn't have the best audio quality on that, but it sounds like you're asking about whether or not you can purchase supplies for Go Kits for emergency preparedness.
Emergency preparedness, basic supplies, whether we can purchase them and distribute them in the community of the very recently arrived refugees.
Yeah, so this is a bit of a nuanced question. Also, hi, I'm Ines, she, her. I am the community liaison for HISPR, Health Security Preparedness and Response. And so Go bags and emergency supply kits, when they're distributed in mass, tend to be very expensive without actually having a lot of return. So we do not fund en masse just creating a lot of go bags, especially because this is a public health grant. What we do say is there are certain specific public health needs that communities have that are not going to be reached by your classic go bag. And so if a go bag has that certain public health twist to it, so it can demonstrate that this is a public health need that we're experiencing and is tied into a really robust system for saying, this is how we are educating people on how to use this. This is how we are ensuring that they have sustainable access. Like, this is how it is part of a larger system. Then that's something we do consider. But, you know, being like, oh, it's a fair and we're handing out go bags is something that we don't consider.
Absolutely. And I want to just second this for Ines. If you haven't checked out our budget guidance document, I'm going to drop the link in the chat. We want to see the connections. We don't want to just buy stuff. So I'm going to give you that feedback very honestly, and I'm going to drop this budget guidance document in here. As Ines said, you need to make the connections back to public health.
Well, connection back to public health, right? But there is one avenue of funding, which is emergency preparedness, is correctly wrong, right? And well, maybe we could ask other question. You could give examples of what would be funded.
Well, and I want to just be clear, Ari, that for the purposes of this work, the emergency preparedness work is public health work as well.
Okay, no, I understand that. I understand that. I'm just trying to figure out how any distribution of anything that could be useful during emergency could be connected to public health so that, you know, it gets funded like this.
No, I totally understand that point. Go ahead, Ines.
So if I can give an example, we have had community organizations in the past that are, say, working specifically with folks who are part of the disability community and have different needs for, like, access to emergency power supplies and things like that. And so then saying, okay, your go bag needs to have things beyond kind of your classic, like food, water, a pair of tennis shoes. So helping people know what they need to put in their go bag as part of that educational element, working with those people specifically, and then saying, okay, now this is part of a larger program where we are connected with you to also help you in an emergency. And so this is where we as a program too wish that our scope was broader. But at the end of the day, we are a really tiny team doing public health emergency preparedness, and there are other than opportunities via, like, the Office of Emergency Management and the Office of Resilience and Emergency Management within those separate state agencies that are doing more general emergency preparedness. And so ours, you really have to weave in that, okay, this is why these people specifically are looking at a special niche when we're doing public health emergency response.
So if I understand correctly, let's say someone needs oxygen supply, or someone who would need a wheelchair or a crutches, okay, very simple. Or in the case of an emergency, so those people with special needs, providing them with very special needs, something that they will need, not typical to go back, but say crutches for the sake of.
Ari, your audio is coming in and out. I'm sorry, I have to.
Okay, sorry. Anyhow, can any kind of supplies and or equipment for people with special needs, something that they will need when that event happens and they need to evacuate, would that be an allowable expense?
I'm gonna step in here and say, what other resources could you connect that person with special needs or disabilities? Like, does that person have Medicaid? Should their medical provider be paying for that wheelchair or for those crutches? I think what we're interested in seeing is how you're going to educate or inform them on how they can be prepared in their unique situation. In general, we're not interested in buying stuff for go bags. Like, in general, that is not the thing that we're interested in. So
Okay.
if you can figure out how to really expand and connect an outreach and education piece, I think that that would be a really strong fit in what you've described.
Okay, thank you. That was useful. Thank you very much.
Absolutely. Okay, Jessica, you're managing the chat. There's a lot coming in through the chat, and we will come back in after we answer these questions to the chat, I promise. Howard, I see your hand.
Yeah, so I'd like to follow up on what Ari was just asking about. So, so the focus of what our application is for, I'm with United Community Action Network. So we're a community action agency covering a couple of counties. And one of our areas of expertise is dealing with utility issues and dealing with homes that are not adequately insulated, et cetera. Our plan has been to submit an application that was going to combine education around climate adaptation for homeowners, along with units that would be for very basic units for air purification or for room AC units that would bolster but not conflict with what may end up coming out through the Medicaid waiver program. I have to say that in listening to what I'm hearing here, I did not see anything in the RFGA nor in the presentations that were given before it that indicated that you folks did not want to see anything that was going to be put into the application that was going to be provided directly to clients. And what I'm hearing back right now, I mean, I'll be very honest, it would just explode our application. And I'm just wondering, I mean, I understand now where you're coming from, but it's not reflected at all in the RFGA. And I don't know what to do about that. I mean, we've been planning our project for a month. We have our local public health authority loves the project. They're super interested in us moving forward. And I'm sitting here right now going, do I even bother submitting this if there's no interest in supporting a big portion of it, which would be the acquisition of equipment that would go along with the program?
Howard, I really appreciate your feedback. I think we've done everything in our power to be really transparent and clear about the information and resources that we've provided. But I actually think that what you're describing is more than just providing direct services. So can I be very clear what I'm talking about when I'm saying direct services? And I've been very clear about this since COVID, because I think COVID changed everything.
Yeah.
I'm talking about paying rent, utilities, buying groceries, buying items for individuals. We are trying to get away from that because we are trying to do work that is going to impact entire communities, right? So we're trying to look more upstream. What you described is an intervention that is around climate adaptation, and you have a very specific population that you want to target. Where my concerns would come in is exactly what you just said. How does that collide with the Medicaid waiver work? Because I know for a fact that they have a butt ton of money, Howard, to buy air conditioners and air filtrations. And I'm not saying we don't want to support your work. I think what we want to do is make sure that we can fund the staffing, the planning, the outreach and engagement, and then help connect you with the waiver people who have millions of dollars to buy air conditioners and air filtration. We want to make sure we're best using the resource that we have. So I'm going to pause because I think Ines probably wants to add to that.
No, that was exactly it, Dolly. And so it's absolutely, we want these projects to go forth. I'm about to copy in as well. And I think it sounds like you've thought of this. And so it won't be an issue. Actually, what we have in the Q&A is the question saying, can these funds be used for climate adaptation devices like air conditioners, air filtration devices, heating devices, etc. And they can, if you are really clearly demonstrating how you're not crossing over with other funding sources. So that's the big thing, right? We can't be like, oh yeah, government, like we're doing this and they're doing that and everyone's doing this. And so if we're really clear, like this is why our recipients are part of a larger scheme that we're doing with education, follow-up, etc. And they do not qualify, because we also know that even when the waiver comes out, there are some people who won't qualify. And
there's going to be a lot of people who won't qualify.
And so that,
and I will just share with you, so what we've got in place is that with both CCOs and both counties that we cover, we're going to have letters of support that are submitted with this, and we're going to have MOUs with them after a decision is made about, to the extent that we get funded, we would have MOUs with them, and we're going to work together to ensure that nobody who qualifies under the waiver would get one of the devices. Right? That's what we're going to do. What we want to do.
You said the magic word. I need you to make sure that is in writing in your application. That will be a very important piece of the puzzle to the application you were proposing.
Okay, and that will be there. So one other just technical question on the work plan. What I've done on the work plan is I just took the format of it, put it on a separate Word document, and then completed it, on that, with the anticipation I would just submit that as its own attachment. I'm assuming that that's an okay way to do it. It just would be its own Word document, but the exact same format. Is that correct? Just wanted to make sure that that's fine.
I'm looking at Jessica and Sasha. My assumption is yes, because my assumption is yes, but please tell me.
Yeah, Howard, yes, that's correct. You are good to go in submitting it.
Okay, all right. Thank you very much.
Thank you.
Robert.
If M and Ricardo have not gone before, I'll wait till they go.
Thank you. Hello, M.
Oh, you all see my dream cabin from another meeting I had earlier today. I don't own it, but if anybody
like it.
Tell me one, I'm with you. Sorry, I've got you on my upper screen. I'll bring you down. So I'm with the ARC Oregon. We support people with intellectual and developmental disabilities across the state. And I'm just, again, clarifying the direct service, because in our world, direct service is if we support someone one-on-one in planning something, but it's sounding like one-on-one planning and training is okay. We just can't okay, I just wanted to double check, because that's our whole thing, is around group training and presentations, and then getting it to that one-on-one level, because those we support, one-on-one works a whole lot better and is more effective for them.
And I want to apologize for throwing us down a rabbit hole with the words direct service, because what I should have said is wraparound supports or buying things. So you were absolutely right. What you're talking about sounds like an amazing project.
Thank you.
Hello, Ricardo.
Yes, hello, Dolly. Yeah, and hello, Jessica and everybody else. Yeah, so my question is, again, is related to the same direct services. So the way we have conceived this project, and in partnership with Linn County Public Health, or in collaboration with them, is that we will kind of build resilience in the Latino, Latinx community in rural Linn County through a strategy that will include providing system navigation support. And by system navigation, I mean assisting people who do not speak the English language access resources. That does not involve that we would give them direct financial assistance, but rather will help them navigate the system. Is that acceptable?
I
It is.
love it. That is very much acceptable.
Okay, as long as we explicitly say that that will not include providing, I suppose, direct financial assistance.
Right. And I think that a lot of CBOs that have partnered with the community engagement team specifically had the opportunity to provide those types of financial direct services to CBO, to community during COVID. And so it's a shift with this specific grant and the funding that we have. So what you've talked about is completely appropriate, and I'm so thrilled to hear about your partnership with Lynn County.
Okay, thank you very much, Dolly. Thank you.
Hi, Robert.
Yeah, so my question is related to this topic. So I'm wondering, how you're going to look at if we're applying for 1.0 positions for this project. So we have a HUD grant to provide money for housing services. What we have found, though, is taking sort of an individual approach to getting people access to that money for housing has not worked. So, we want to create, so part of this is developing community capacity, engage using the CBPR, community-based participatory research approach, right? And creating networks to be able to advocate the policy and then engage with the LPHAs so they can sort of let them know how public health works, what resources are available. So, part of that work will be involving people that become part of this network, those services. We also have like the largest food pantry on the west side. We serve 13,000 people a year. So linking them to those services, even though they're coming to us for housing. And then we also have one of the few senior centers. I think we're the only one in the west side that provides comprehensive services. So then anybody over 50 qualifies for those services, and then linking people to those services. So I just want to make sure that that abides by the spirit of this RFGA. Yeah.
So you said some great things, Robert, and it sounds to me like you have what your question is can I have staff who are funded in this grant to do a certain percentage amount of work and also do other things?
100% of the work, or like at 1.0.
Dude,
okay, awesome.
Robert, you said my most favorite thing, and if you've been to one of these webinars, my number one favorite thing to see in a budget is FTE. We want nothing more than for you to pay people to do this work. So yes, Robert, put it in your budget. I'm here for it.
Yeah, and we're doing it. We're doing it in a broad way, community health workers, right? So that it's sustainable funding, because we don't believe in creating positions that are going to go away after. We serve immigrant and refugee communities. Right now, it's the Afghan population and also the Ukraine population, in addition to BIPOC, and of course, Latinx immigrants. And really, they're more indigenous nowadays because, Mexican folks have got inside places, and it's mostly indigenous Mexicans that are doing the backbreaking work now. So anyways, all right, thank you.
Thank you. Jessica, let's go back to the chat.
Yeah. So, question that we had for the work plan, is it okay to copy the template on a Word document and then fill in that same information that would be required in the template? So I believe what you're asking is, can you use a Word document and then copy, paste, move over your answers into the template? And if that's the case, then absolutely. Another question was whether there were word limits in the narrative fields. So back to character limits, again, if it's Smartsheet questions, Smartsheet itself, their cells, and they only allow 4,000 characters. But on the other things like the work plan, it's just a Word template. So you can type in what you need to. So that's the answer there regarding limits, and there isn't one for the work plan. But again, just make sure that you're just providing the information that you need to communicate what needs to be communicated. And then there was also questions regarding chances of an application from a Tri-County area CBO being considered and whether we could quantify that. And I said a little bit, and so did Dolly, that we can't really do this because we don't know how many applications we're going to get and what types of amounts will be requested for funding. And then Dolly also responded that we do expect there to be funds that will be available for Tri-County areas. So that was the answer on that one. Let's see, clarifying question about partner coordination. Can you give us more clarity on the section? I think this one was the one that was actually already answered, so I am going to skip it. When will funding awards be announced? And the answer to that is that we're hoping to have reviews completed by the end of January. So notices would go out thereafter. So we're estimating right now beginning February for you. Someone asked regarding wellness fairs that include vaccines, emergency preparedness. Again, that was already covered. Yes, wellness fairs are allowed. The only thing that I wanted to kind of highlight is paying for vaccines is not an allowable expense. So just wanted to add that there. And then we had Ricardo's question regarding system navigation support that was already replied to as well. So I'll skip that. And someone asked, can these funds be used for climate adaptation devices? To which the response was, they can be used for these devices if they support prevention and lessen the impact of climate events on healthcare capacity. Recipients of devices must not be eligible to receive these devices via other programs, such as state, federal programs, or regional resources, and the application must acknowledge what other options may be available and why they are not applicable. And then I did want to circle back to Robert's question regarding attachment 5, and I think the wording on the RFGA is, I want to acknowledge, is confusing. So this is referring to the insurance requirements that we request. And so Exhibit C lists those insurance requirements. So again, it's not an additional attachment, but you need to have these insurances for this grant. So just wanted to reply to that. And that's all that I have tracked that we didn't get to. So handing it back on over, open floor for other questions. Hi, Robert, go ahead.
Oh, you're on mute.
Actually, I am forgetting my question now. One of the questions I did have though is it's $250,000 per applicant. So it's per organization, right?
Correct.
And I'll remember my question. It was actually, I'll think about it.
That's cool. We're here. And this is exactly why we're doing it. So I want to really acknowledge that applying for funding opportunities is confusing. It's a lot. The first time we did this, someone asked in the chat, how many did we get? We got 300. And someone else asked, well, who are your current grantees? I also dropped a link to that in the chat. We do have currently 157 grantees. So from that first round, we identified 157 organizations to bring on. Through this round, we're expanding that. We have an additional $10 million, and we plan to distribute those awards with about a $250,000 cap per organization. That's approximately 40 additional organizations that we're going to be able to fund. I saw your hand, Robert.
Yeah, I remember my question. And I apologize if someone asked this earlier. I believe the grant term is 16 months, correct?
Zach, 18? What is it? Because we're going to go back to February 1st.
Or we're going to start early. It's going to start earlier.
It's 17 months.
17 months.
It is
So-
effective February, regardless of.
Correct. So we will start the award. The contracts will be dated back to February 1st. I'm gonna tell you now, you ain't getting money February 1st, but we're gonna let CBOs that are awarded retroact back to February 1st. So that.
So the
makes
question, yeah, the question that I had is, do we have to work during the whole 17 months?
I hope so. We want to hang out with you, Robert. We want to be your friend.
No,
Well,
you don't.
I've done, so it could be like a year-long project, right?
What I would say to you is, if you have a set amount of time for the work that you want to do and a set amount of money that you need to accomplish that, and then you're done, that's fine. But it doesn't mean that we're not going to continue to send you quarterly activity and expense reports, asking you to report on what's been happening. So I think that's the compromise between what I just said and what Zach said, because you can do your project, like you could be like, we're going to do this thing, and when it's done, we're done. And you could submit that as your proposal. But every quarter, I'm still going to send you an activity and expense report.
Yeah. And then the other question that I had, and I've done this, I worked in Colorado for a long time. And I created a statewide network in 27 counties with over 30 public health agencies to address Latinx health disparities. And one of the things that I was able to do in that process, because people were across the region, was to get people to share work plans, because people have different levels of capacity around that issue. So I didn't know if there was a space where we could share work plans, or, you know, the initial grant that I submitted. We submitted two for 100,000, and they loved it so much they decided to give us 380,000. Because like it was like a two-stage process, and like, we want to do all this now. So, but anyways, I just would like to.
It's like, Robert, it's like you
you
attended a meeting with me this morning and knew that I literally talked about this very topic, and my team doesn't even know about it. So they're not going to be super excited when I say, yes, in fact, Robert, we will be creating a process in which CBOs can share, and we will help to share all of the CBO work plans and make them available. And specifically, they will be shared with local public health, and local public health work plans will be shared with CBOs. So y'all, I need you to know that I'm not even going to start working on this process until January, but it is a thing that we will be doing, Robert. Thank you. And I love that idea. And I love that you are interested in seeing other people's work plans.
Thank you.
See, my staff is not happy. You saw the Zach face. I'm sorry.
I also want to highlight that we do have a fiscal guidance document on the RFGA page. A lot of the questions that folks asked today are on there. So just want to highlight that document as well, that outlines a lot of allowable and not allowable expenses for you to be able to reference as well.
I want to just uplift for a moment that we have multiple program staff on the line. If you have specific questions related to the program, we have acute communicable disease emergency preparedness. We have drinking water. Do we have anyone from EPH? Emma, we do. We have some climate folks. So this is also an opportunity for you to ask really specific questions about the programs if you would like.
One of the questions that I had sent, I don't think I got an email response. But some of the stuff has been going to junk mail, but that's not the one of the ones. Was in order for people to be able to get, participate in the program where they provide air conditioners and air filters to people, do they have to apply under this grant, or is that a completely separate and independent process?
It's separate. And
Okay.
I very proudly say it is not our program, because it is a lot of work to sling air conditioners. I know from personal experience when that program started, we accidentally volunteered to help, and I can fit 6 air conditioners into a Kia Soul, is what I want you to know. So we are not in the business of air conditioners anymore. We would, again, want to redirect to those programs. Guess what? We're friends with them. So that's one of the other benefits of partnering with community engagement team, is we will make sure you get connected to the people that have the resource that you need, even if it's not within our bucket.
That's the whole point of this grant.
That's right.
Because nobody else is asking questions. Given that you have all these applicants,
we hope
is
to
one of
have
the-
all these applicants, Robert. We hope to have all these applicants. What I'm noticing is people like to submit at the last minute, because we actually don't have that many applications right now. And I think it's because you're all here answering your last questions.
Well, yeah, and program directors are famous for being too busy to pay attention to the grant until a week before it's due. But I laid the line. I was like, if you don't get it to me by Thursday, it's not going in, because I ain't working at the last minute to try to do things. So the question, I forgot my question now. Oh yeah, so if you have different applicants, and certain organizations are asking for more than others, is it possible that you'll say, hey, we'll fund you, but we want, I think 2 of the chief concerns were the dispersing of funds to communities and to geographic areas, right? And then excluding people who had gotten money before. Will you say, we'll fund you, but only at this amount? Or we'll give you more because we love your program so much. I'm just kidding. But
who knows? Maybe that happens. I'm not going to say. I don't know that it will, but miracles happen. So Robert, excellent questions. Our priority is to make sure that we're equitably distributing our resource, i.e. money, across to all communities. And that's part of why we're being very strategic in how we're recruiting right now. Where we have prioritized is where we see gaps in how we distributed our grant the last time. And so that is why we're prioritizing in the way that we are. It is very possible, and I was in a meeting this morning with Jessica and Sasha about this very topic, that a CBO submits something. Let's say you apply for climate and well water, and we really don't like your climate application, but we like your well water application. And so we're only going to fund part of what you've submitted. It might also be that you submitted and we say we like everything but this piece, and we're not going to fund this piece. Here's how much money we're giving you. Resubmit your budget and work plan minus this part that we don't want to fund. Or more than likely, we're going to be saying, what could it look like for you to XYZ, partner with this local public health, be in the mix? Because Robert, what we don't know is if an emergency was to happen, and it's part of why I like to keep our CBOs contacts tight. And in this process, you become part of our network. So if there becomes wildfires, or let's say something happens on the coast, I know Erlette is here, and we say we need support in Coos County or in Josephine County, we can look in our already pool of CBOs and say, can you stop doing that vaccine work because there's a wildfire and we really need your support reaching, you know, Latino Spanish speaking communities in this part of the state. Help us now. So that's part of why we have some flexibility in the work, because all of us, we don't know. And guess what? The climate adapted the environment to have that wildfire. So we're thinking about how we can work with community to address things as they're coming up.
I have more questions if no one's going to ask questions. Or maybe just an observation. You know, way back, I got hired to do a community assessment for this community in Boulder, in Colorado, near Boulder, Colorado, that had an explosion of Latinx community, and to assess the services that they were getting in terms of public safety, health, education, all those kinds of resources. And there was a clinic there that saw people, they were undocumented. And when they went in, you know, given the way the American health system works, even though 3 of the kids had the flu or the cold or whatever, they could only see 1 kid, and then they would have to wait until another appointment, 3 months or whatever. So they have to choose like which kid, you know, of their 3 kids they could see, even though they obviously had the same cold or virus or flu. And I feel like with this grant, one of the things that we're wrestling with is, you know, there's a great need, right? Especially among immigrant and refugee communities, right? And there's sort of this hierarchy of needs, so to speak, right? Housing, food, you know, those kind of things. But on the other hand, there are, you know, the communities are extremely stressed because of COVID and the economic circumstances. So they've let us know, like, we need something to be able to deal with these stress issues that we're encountering. And then child abuse, right? Because in the home country, hitting kids or, you know, being very harsh with kids is allowable, but it's not allowable here in the US, right? So we have to choose between the two in terms of what it is that we would fund. So yeah, I mean, that's sort of like it's like we have to choose like between our family members, you know, in terms of what it is that we apply for. Yeah, so I just wanted to make that observation.
Really important observation. One of the things that we're working towards, and just for everyone's information, we will open this grant up again in 2025. And one of our dreams, and I don't know if it'll happen or not, but is to create a project or box related to social determinants of health. Because I think that's a lot of what you're describing right now. There are these different things within community that actually impact one's individual health. And what could we be doing and what could we be looking at to address that on a community level? And we're not quite there, but we're slowly building out this work and this program, and we hope to be able to explore some of those other topics that community tells us is important. And it may not fully fit in with what we're doing, but we're exploring how to be more flexible. So hopefully that will happen.
Yeah, and I think one of the things that would be helpful, I guess, also is if, and I don't know if this is possible, but if CBOs were aware of what was coming down the pipeline, so that in making these choices, we know how the priority, the strategic priorities, funding priorities are being set up and when they're coming out, so that we know how to make these decisions.
Excellent feedback. Excellent feedback. Hi, Em, I see your hand up.
Yes, I came up with another question. So in the application, it says, describe the composition of your project staff and decision-making body and how these reflect the communities you're proposing to work with. And like I said, we work with those who experience intellectual and developmental disabilities. You're not asking for like protected health information of diagnosis. Could we just do like a summary sentence that 9 of our board members are self-advocates and 5 are direct family members?
That's
Okay.
exactly what I want to hear. And part of why we're doing that is because we want to uplift organizations that reflect the communities they serve.
Okay, I just wanted to make sure because we work with folks that a lot of it's protected health information of what their
I
diagnosis
get
is,
it.
and I don't want to give
No,
that
not at all. And I'm flagging this for my buddy Nathan because this is part of us prioritizing specifically the disability community. In prioritizing that, we're gonna look and see. And so yes, that statement will be helpful for us.
Thank you.
We are down to the last few minutes. So if there's anyone who hasn't yet had an opportunity to ask a question, I'd like to create space for you to ask your question now. Are we allowed to stack funds? For instance, my organization is hoping to utilize funds to cover 20% of acquisition installation of mini splits for climate adaptation. Should we focus more on an admin and staff support? Ooh, Emma, I'm gonna ask you to help because I don't know what mini splits are. Installation of mini splits. Emma, are you around still?
Hi, I am here. Let's see. Oh, okay.
I like that you know what this is, Chloe. It's kind of air conditioning. I had no idea. I learned something new today. So the question is, are we allowed to stack funds for? So I'm thinking the answer is yes. I think what you're asking, and Zach and Sasha, correct me, we wouldn't prioritize using our funds to buy air conditioners. And I would much rather see you use our funds to pay for your staff. Zach, did I say that in the right way?
Yeah, I totally agree with you there. But also you can stack funds. Like you can leverage our funding with other funding sources and just, be clear to us about what you're spending our money on. And if you can leverage that with other monies and complete greater projects because of it, that's great. But also to Dolly's point, yeah, that we are more interested in funding admin and staff than we are things. But we've also heard great conversation in this meeting about how it can all be connected and work together. So that's all I got.
Ductless heat pumps, man, I need one of those. Like, what do I got? I need one of these in my own house. Like, learning a lot. Excellent questions. Emma, did you want to add anything to that? Ductless heat pumps.
They're pretty great. Yeah, they're fairly energy efficient and they can do some great stuff. So, yeah.
Thank you, Emma. Anybody else have questions before we close out this session?
I guess I'm still thinking about, this hard choice that we have to make. So I was wondering about how wise it would be to sort of kind of stack things in terms of like, this is what we want to fund. But if you see any portion of the grant that's not fundable, then look at this. Because what I'm concerned is that you would look at this sort of third option and say, we really like that option instead of these 2 other options. So can we request these are our 2 fundamental things. And if it's good enough, we'd love to get funded for them. But in the case that you decide that this is not something you want to fund, then look at this, I guess is what I'm thinking in terms of trying to wrestle with this decision that we're having to make as an organization.
Yeah. I'm gonna make an executive decision on this specific thing and say, no, we can't.
Okay.
Because what I'm preparing for, and Sasha and Jessica and I met this morning, is in my head, we're not gonna get 300 applications again, because we're already funding half of those CBOs. But I think we need to be prepared. And I don't want to promise that I'm going to do anything special on an application that I couldn't potentially do for all, let's say 300 applications that we might receive. So I'm going to say no. And I also want to be very clear, me, Dolly, Jessica, the community engagement team, are stewards of this grant. And we partner very closely with all of the programs that are on here. So at the end of the day, it won't be us choosing which CBOs are going to be awarded. Your budget and your work plan are really important when it comes to this process. We're looking for strong applications. We're looking for strong work plans, and they're going to be connected to a program area, and those program staff are the ones that are going to be reviewing those applications. So I encourage folks to be strong as it relates to the program area. That is what we're really interested in, and is seeing the work align in whichever program areas you're selecting. And in the event, Robert, that the program decides we don't want to fund this body of work, but we do want to fund this other body of work, we as OHA would come to you as an organization and say as much, and then you as an organization could decline. So you could say, that's fine, we don't want to do that body of work, that's not our priority, and so we're going to decline funds for that, whatever. So I'm just making sure you understand, as an organization, you also would have the ability to decline whatever it is we've proposed back to you.
Yeah.
All right, my expectation is that I'm going to see like 30 applications in our inbox Friday by 3 p.m. Hi, Ellis. Do you have a question?
No, I just want to thank you for everything and for the partners. I just met with some in this area, in your organization, and they what I've learned is that there's more resources that they may have available that we could use. So looking forward to that. And thank you.
So happy to hear that. Definitely reach out. There's lots of people that want to partner and connect.
Okay, thank you. See you soon.
Thank you all. I hope to look and see your application in our box. Thank you all very much. Have a wonderful rest of your day. Yes.
Thank y'all for writing a great RFGA. A lot of them I don't get. There was one that was based on obstacles, and there was like all sorts of questions to address all the other things, but there was like maybe like at most 3 sentences in the whole thing about barriers and obstacles. I was like, I don't get it. Explain to me how we're supposed to address these if you don't give us any instructions and you only give us 3 lines about it. So, and I never heard back. So at any rate, thank you a lot. Thanks. And hopefully we'll be working together. It'd be great to create a process where one of the things that I was able to do in Colorado was get community members to help write the RFGA.
Ooh,
because that's one of the challenges too, in terms of,
Robert,